Thank you so much for joining. We are offering this very brief webinar today because Camila and I are trained in psychedelic-assisted therapy, and we work with ketamine, both individually, in group formats, as well as in retreat formats. And what we wanted to share is how ketamine-assisted therapy can work as an adjunct to either psychoanalysis or any form of talk therapy. So we're going to go through some of the misconceptions that are floating around where people are saying like, oh my gosh, I'm going to take a psychedelic and it's like 10 years of therapy. So we just wanted to clarify how these new modalities that have a lot of evidence and research behind them actually thrive with therapy, and what you might expect if your clients ask about these treatments or if they wish to potentially integrate it. So our point of view is that psychoanalysis or talk therapy is by no means becoming obsolete. Both Camila and myself, we are therapists. So we are strong defenders when clients are asking us about these treatments to combine it with therapy. So we want to share our knowledge with you. Obviously, there's a lot of knowledge out there, and we could host a couple of these webinars, but we're going to keep it streamlined to this aspect of how, just briefly, what ketamine is and how it works with talk therapy. So you did see our faces already. So this is us. I am Nikki Fall. I'm a clinical psychologist, a social worker. I'm an EMDR trauma therapist and a psychoanalyst. And my business partner and colleague, Camila Pastor, very similarly, also a therapist. She's trained in somatic experiencing. She's also an EMDR trauma therapist. And Camila has a lot of experience facilitating psychedelic ceremonies, not just here, but also abroad in Latin America. And we're certified in psychedelic-assisted therapy. That is actually a path of continued education that one can choose these days. So we have certificates in this field and are considered experts. And as I already mentioned, we run group formats as well, which are very powerful, as well as retreats that bring us much joy, witnessing people heal in all of these different ways. So why are we doing this? And this is a quote from Michael Eigen, which I thought was very fitting with why we're doing this. So as he says in his book, The Psychoanalytic Mystic, can we take a little more, let a little bit more intensity build and work its way through effective expression so that we begin to notice what calls us into life or prevents us from living? So that is why we work with psychedelics. That is why we suggested or recommended to our clients to build, to let more opening in, to let intensity build a little bit more, right? So that things can come through and people can really start noticing and kind of, right? Like noticing really, truly what is calling them into life and what is getting into the way in a very beautiful way. And we will tell you all about it. So again, our goals for today is to tell you very quickly what is ketamine. We're not going to give you a whole biological download and chemistry download. So just in a nutshell, high level, what is ketamine? So you have a basic understanding. We're telling you why exactly we are using it or other psychedelic therapists. What do clients experience? What can your clients expect if they do sign up for it? You may have heard the word integration as opposed to therapy when we work with psychedelics. So there is a term, integration. So we'll tell you briefly what it is that we do and how it might differ from therapy. And then, as I said, why do we advocate for therapy in the healing process? How does therapy fit into this concept of psychedelic-assisted therapy? So about ketamine, and this actually is ketamine. It comes in many different ways. We're not going to touch on all of the different ways that ketamine can be administered. Camila and I, or a lot of psychedelic or therapists who use it in our practice, we work with lozenges because it doesn't require us being doctors that can administer shots or IV infusions, right? So we work in pill format. We call them lozenges, and people put them in their mouth and they let them dissolve under the tongue in the mouth and then swish them around. The absorption is not through the gut by swallowing it, but by keeping the ketamine in the mouth for a good 15 to 20 minutes. The ketamine gets absorbed through the lining in the mouth, and that is the way that it makes its way into the brain. And then people either swallow it or they spit it out, and that's a whole other discussion that we won't get into. But yeah, this is what ketamine looks like. And some quick facts. Ketamine has actually been around for a long time. It was first produced in 1962, has been used as an anesthetic. It became FDA approved in 1970. It is on the World Health Organization essential medication list. It is still used as an anesthetic, even in the NICU, because it is very safe to use, even for children. We use ketamine even in psychedelic-assisted therapy with families and children or teenagers. It is prescribed off-label for use of treatment-resistant depression, PTSD, anxiety, suicidality, and other conditions. It works on the NMDA receptor, which I will say a little bit more about. It works very different from regular antidepressants, which work mainly on serotonin or other receptors. And there is this very important concept of neuroplasticity that we will also touch upon, because it is very different in how it's very important in the concept of therapy. So we'll talk a lot about neuroplasticity. So as I just said, ketamine has the property of being an anesthetic and is still used that way because it kills the response to pain. But at certain dosages, it can bring you, so at high dosages, it keeps you or brings you into this deep plane of anesthesia. But what has been discovered in the early 2000s is that at lesser dosages, it takes you to this interesting transition point between, right, being awake and deeply anesthetized. So like more of like this dreamlike state, right? So that is the state that we're working on. We don't give people the same amount, that they're getting in an ER before they're going into any operations. We're working at much, much lower dosages. And at those lower dosages, we can see that ketamine works very rapidly, almost immediately, to decrease symptoms of organic depressive disorders. It also appears to relieve or improve ruminative thinking or rigid thought patterns. So we always let people know that it has this potential to increase cognitive flexibility. It breaks through OCD properties, these obsessional thought patterns. It also breaks old patterns of activity and helps people reinforce new patterns of activity. And it also has these highly psychedelic-like properties, which is why we call it a psychedelic, even though in the strict sense, it's not a psychedelic. But it very much so brings on these psychedelic-like qualities in the journey when people take it at these sub-anesthetic levels. And how it is doing that, right? Like people can have very intense experiences, like feeling in the presence of God, having mystical experiences. How it's doing that, we don't know. But it does turn out that for some people, the psychedelic effect or the psychedelic properties also contribute to this very robust antidepressant effect. So ketamine works at very many levels, right? So we can talk about ketamine at purely the chemical level, and ketamine clinics or certain providers very much work with ketamine in that way, just looking at what it does in the brain, working with the neuroplasticity, with that immediate antidepressant effect, without really considering or thinking through the psychedelic effects that it produces. So we can look at it from purely what it does at that level. We can talk about it as a catalyst for psychotherapy. And that is what we'll share with you today as well, right? And then we can also think about it from this realm of otherworldly mystical experiences that, as I just said, also relate to antidepressant effects. The safety profile. Psychedelics are in the news more and more so, right? So clients always ask, is it safe, right? Like I heard about it as a horse tranquilizer. So there are a lot of different information floating around. So it is important to know what the safety profile of ketamine actually looks like. So as I already said, you know, it is used with kids in emergency medicine for a reason, in trauma surgery. So it has a history of safe, effective use in medicine for more than 50 years. We don't overuse it, right? So ketamine gets prescribed by medical professionals for a time-limited amount. And when used in that way, it doesn't lead to addictive relationships with a substance, right? But it does have potential for abuse, and we do want to be clear about it. But that is why we're very much in a working relationship with the clients, with medical providers, right? And really monitor how many treatments does one need. And it's usually not a lot, right? So we're not talking about months or years on end of working with ketamine. It can be as little as 4, 5, 6 treatments, right? And at those frequencies, we're not really concerned about addiction. Psychedelics generally don't have significant toxicity to body organs. With MDMA and ketamine, that is slightly different, which is why clients do get medical intakes. So we're educating people who have heart issues or blood pressure issues on other options, or people need to be on blood pressure medication to be able to do either MDMA or ketamine. But again, that is something that gets assessed in medical intakes. And once people are cleared by their medical provider, we are not concerned about the safety profile. But those are things to keep in mind. So if you do have clients with heart issues or blood pressure issues, they definitely need to talk to the doctor and get clearance. And yes, I mean, there is, of course, a mental or psychological risk of getting addicted to ketamine, but one has to then think through, right, might these people who psychologically get addicted to ketamine get addicted to other substances as well, right? So it's not necessarily due to the ketamine, but due to the effect that it can produce, the stepping outside of the body, this effect of relaxation, right, and letting go of one's issues. And there are studies, for example, in Southeast Asia, where they asked, high school girls and young women, who were saying like, yes, I love to use ketamine after school because my parents don't notice, right? I can get really high after school, still be home in time for dinner. And so in that sense, it does have powerful addictive potential because it is so powerful and short acting. But again, it's not necessarily because of the properties of the ketamine. It is because of the specific profile of the person using it. So this is what I just touched upon already. So ketamine and addiction. In a nutshell, we do not think that ketamine is inherently addictive, right? It does have tremendous potential for addiction that we need to be mindful of and really keep in mind when we're working with people. But generally speaking, it has very minimal physical addictive potential if it is used in low dosage range, like what we use in our therapeutic applications, when we use it infrequently and also with space in between. So the potential effects, right? Like what can people expect who are going through the experience? So first of all, as I already mentioned, it is an antidepressant and much more. There's a lot of evidence. Once I share this deck with you, you will see that there are many, many, many resources that that we've added to this deck as well. If you are curious to read up on the research, there's a lot of evidence that ketamine is helpful for depressive disorder. We actually can use it for bipolar as well. Depression from physical injury or chronic pain, for OCD, for suicidal ideations, for social anxiety, generalized anxiety disorder, postpartum, substance abuse disorders, which always surprises people because I just talked about the safety profile, right? And that it may have, and that it has the psychological, mental profile of addiction because it is so powerful, right? Yet it can be used for substance abuse disorders. When people with alcohol or any kind of substance abuse use it, right, they can actually like zoom out and have this effect of really getting clarity on their life, right, and distancing themselves or gaining more control over the substance abuse. So it sounds paradox, but it's really powerful in that sense as well. And for some chronic pain conditions, there's also still research right now for eating disorders. I think that is currently being researched as well. So lots and lots and lots of research across the board for ketamine and its healing properties. And Stanislav Grof, who is a big, big personality in the world of psychedelics, you may have heard of him. If not, look him up. He has done tremendous work. He is a psychiatrist, and he said, or his belief is, based on all of years and years of research and working with patients and clients, psychedelics used responsibly and with proper caution would be for psychiatry what the microscope is for biology and medicine, or what the telescope is for astronomy. I think that's a very powerful quote, and I think providers or therapists or psychiatrists who are working with psychedelics would very much agree with this. Sorry, so now we're getting into the experience. So that section was more about like, why do we use it? We use it because it has very, very powerful effects from mental health treatment and well-being. So getting into the experience, the fun part. Psychedelics and ketamine as well are called non-specific amplifiers, and they are called that because they show us whatever is in the mind. Lower dosages occasion light detachment and a capacity for reflecting on oneself, on life, on our situations. In higher dosages, we may have more profound reassessments of reality, our place in the world, in what we call reality, and it may have very transformative effects that can be carried back into one's daily life. You may feel some kind of intensification or alteration of conscious aspects of what we call the ordinary mind, right? And it brings material from a Freudian understanding of the unconscious into awareness. So it goes past our defenses and goes really deep into what is in our mind, and whatever is there will be shown to us. And that is why we call it non-specific. We cannot guide it. Psychedelics often heighten or amplify awareness of sensory perceptions. So visual, auditory, tactile, and our thoughts and feelings all get amplified. We're becoming more aware of all of it. There may be a heightened emotional quality associated with our perceptions and our thoughts in general. There are also alterations or changes or transformations of these sensory perceptions. So we can feel motion where motion is usually not experienced. We can have multiple visual images. We can have distortions of perspective, hallucinations. Synesthesia, where a mixing of various sensory channels can happen. So what we're seeing, for example, can be experienced as something that we're hearing as well, right? So all of a sudden we can hear color. That will be an example. A very powerful concept as well is the dissolution of ego boundaries or ego death. You may have heard that term. And Michael Pollan, if you haven't seen, he has a book out and a Netflix series where he shares some of his experiences of dissolution of ego boundaries. And I'm going to read this quote because it's a nice example of one might imagine what ego boundaries look like. And these usually happen at higher dosages of psychedelic usage. So Michael says, I had the experience of watching my sense of self explode in a cloud of Post-it notes. And that was clearly me, and I was no more. And they fell to the ground, the Post-it notes, and they pooled. And this blue paint appeared on the ground. And it was me. It was the I. But some other perspective emerged that was not me exactly. It was something very neutral, very objective, that was observing the scene. And that separation was very strange and kind of wonderful. It changed my relationship to my ego. I no longer felt I was identical to it. I no longer felt I had to listen to it all the time. I can step back and say, all right, well, that's my ego talking. And there are other voices there I can pay attention to. And this is something that I would say is something that we say of ketamine with people, like this sense of stepping, of zooming out, of being able to assume like a calm outside perspective. Like we're always taking like emotions out and we're zooming out, and we develop this capacity of stepping aside and looking at our issues from a different perspective, which feels very calming to people. And this dissolution of ego boundaries and feeling, right, like, oh, the ego is separate from the I, and who's the I, and being able to reflect on these things and experiencing ourselves in very different way is very, very fascinating. Which takes us to the last section of integration and therapy. So the common misperceptions here that we always hear and that we have to work with a lot are the questions that people ask, such as, well, will the change be happening to me? And what they mean, what clients mean with this is there some sort of like magical pill, right, that I just take and something happens to me and my problems will just be taken away, right? Something like the medicine is going to come and just completely change me and take things out of me, right? And that is not the case at all. When we're working with ketamine or other psychedelics, right, like we always say to people that they are very much in charge. They are the agents of change. Psychedelics and ketamine is not coming in to magically fix anything or take things away or dissolve things, right? Take the unhappiness away, take the depression away, take the anxiety away, right? So change is not happening to them. We sometimes give this analogy of a broken arm and a cast being applied to the broken arm, right? So if the doctor applies a cast, right, the cast is not doing the healing, right? The cast is there to support the body, right? The body knows, or the arm knows how to heal, right? It just needs the support of the cast to do it well. But with support, it knows what to do, right? So that is how psychedelics work. They're there like a cast, like a support to open us up to our inner healer, to our inner wisdom, right? But clients still very much have to do the work, and they have to go into this work with a lot of preparation, with a lot of self-awareness, with intentions. And they have to be ready to do the work. And that is also what differentiates psychedelic-assisted therapy from recreational usage, where people oftentimes don't have knowledge, don't have preparation, don't enter this process of deep self-reflection, of intentions, right? Of opening themselves up to, okay, what am I trying to learn from this medicine? What do I need more of? What do I need to understand? And opening themselves up to this process of curiosity and openness, right? And because of that, they have very different experiences than people who do or who take psychedelics in a recreational context. Psychedelics are said to be the only medicine that works very differently depending on what we call the set and the setting. So if you take an antibiotic, right, it doesn't matter if you take it in your car, if you take it at home, if your kids are around, if you're alone, if you're taking it in the morning, if you're taking it at night, if you're anxious, if you're not anxious, an antibiotic will always work in the same way and do what it has to do in your body. And psychedelics are not like that at all. Every experience is different. The mindset matters. The setting matters. Whether people are prepared, whether they know what they're doing, whether they feel safe. So doing it with friends, unprepared, right, in an unsafe setting, being surrounded by loud music, by dance, by a lot of distraction, but not knowing where your support system is, where your friends are, right? Doing it alone at night at Central Park in New York City, you know, versus doing it in a therapist office or in a beautiful retreat setting where one knows the therapist, knows that they're taken care of, that they're safe. All matters. It all matters. So we prepare people and we teach them how to journey. We teach them how to open themselves up to this process. We let them know that we are there by their side to guide them through their experience. And when all of that happens, people also don't tend to have what is often called in the media or so in the media, bad trips that people are very afraid of, right? We're not really afraid of bad trips. We know that uncomfortable material can open up because, right, that is why we do the work. But we also know that there's something very powerful and transformative in the work that we're doing, and that people can come through it by assuming a certain mindset. And we do know that if people are in these safe environments with therapists or with fellow group members, that they journey through this process very well. And we also teach them about how to work with therapy and their experiences so that they understand that nothing is happening to them, that they are in charge, that they are the captains of these ships of change, and that they are entering a process of change with a lot of support and with therapy. Is it like 10 years of therapy in one? Yes and no. Sometimes people have very powerful transformative experiences where they truly feel like, oh my gosh, I always knew, but now I really know. Or they come out of it with really feeling like significant shifts at their personality level have happened. Very transformative. Yes, that can happen. And there's always some transformative shift. But we would never promise that to anyone. We would never tell a client like, yes, you take it, it's like a magical pill or like a magical carpet, right? You step on it and yes, right? Like you can skip therapy and right, like you're never going to need therapy again. It doesn't happen that way. And even if people have transformative experiences, right, it can still offset a lot of emotions, right? Like grief of, oh my gosh, now I'm really noticing this is what I've lost. Or, oh my gosh, right? Like I feel so different now. What does that mean? I need help like coming together or working with this change, right? Or people simply see life, right, and sense the opportunity, right, and then still need to put it into action where therapy comes in. So it's a very powerful start into a very powerful process, but we would never ever say yes, it is like 10 years of therapy. but it is powerful. It is certainly very, very powerful. Another thing that we work with is people's expectations. Because even if people say like, yeah, you know, I read up upon it, of course, I don't have expectation, I know it's work, right? We still find people oftentimes saying when they have experiences that they didn't expect, like, well, this didn't feel great. I don't think that worked, right? Again, because they do assume that taking a psychedelic will feel like 10 years of therapy, or that the change will be happening to them and that somehow magically things will just melt away, right? So this is where work comes in. Work in the integration process, work in therapy to help people understand whatever happened was meant for you. Whatever you experienced, even if it wasn't wonderful, was still transformative, was meant for you, and change did happen. You're just going into your mind, you're becoming frustrated, right? As opposed to staying curious and working with the experience that was given to you. So that is part of the integration work and part of what we want to teach you so that you know that this can happen and that there is a skill and a process that we have to work with to help people notice psychedelic change. Will this change my life forever? Again, this is where therapy comes in, and we'll tell you more about it. It's a very transformative process, but it is a process and it is work, and it's very exciting work. And will I know everything? And what I mean by here is people also come with expectations of having mystical experience, right? There are a lot of mystical accounts online that people read about, right? That go back to this 10 years of therapy, people who have mystical experience and who are meeting consciousness or whatever the experience of this otherworldly mystical experience is. And it tends to correlate with a sense of well-being, with a lot of healing, with a lot of transformational change. So people tend to, even if they say like, yes, I'm open to this process, yes, I'm willing to just see what comes and enter this work, we usually find that in the back of their mind, there is this hope, right? Like, oh, am I going to have this experience? Am I going to be able to meet myself, right, in a very different way and feel this peace, right? And that is something that we can't promise at all. We can't promise that people will open up and that they will have a process of transformation, right? But can we promise a mystical experience? No, we can't. And that is okay, because it doesn't take away from the power of working with psychedelics and with the change and the healing powers that people can experience. So it's just important to not get hung up on any of these misperceptions. And if people don't get hung up, they tend to get a lot of healing and a lot of change out of it, right? But again, they need to understand that they are the captains of these ships, that change is not just magically happening to them, that it is a process, that they can't expect this mystical experience that will feel like 10 years of experience, that it might not feel wonderful, and that is okay, that something very powerful is in whatever was given to them, and to just trust that. And that is part of the work that we're doing with them. Unfortunately, therapy is not always a given. It's not always part of psychedelic treatment modalities. So there is what Camila and I are doing, ketamine-assisted psychotherapy, also known as KAP or as CAT. And that is a form of therapy where ketamine is taken by the patient while they are with a therapist or a provider. The ketamine is considered a therapeutic intervention, but used in conjunction with various forms of counseling and therapy. So whether that is with us as psychedelic therapists and therapists, or whether that is with you, right? So patients might sit with us for 3, 4, 5, sessions to get this opening and have some integration. But we always encourage them to continue working with their therapist and to work with the material that has come up. So then the ketamine becomes an aid in your process, right? You may have also heard that there are different ways of working with ketamine as part of KAP. So it can be at a psychedelic level. And by that, we mean higher dosages that allow for states of consciousness that go beyond our ego with a lessened ability to talk during the experience. So that is when people have high enough dosages that they are right in the dreamlike state. They usually just lean back, very still, and they really don't talk much or don't feel like talking, and they have a very inner directed experience. And then the talking happens after the experience, whether it's an integration, which happens usually the day or within 3 days with an integration therapist or with you in your practice. And then there's also a psycholytic approach where people take very, very little ketamine. And so they're still present. They could sit in our office, right, and have a regular talk therapy session, but they have a little bit of ketamine in their system, which allows them to have a little bit more openness, right, in their brain, in their mind, in their body, right? And we don't, I don't know if Camila, like we usually don't work that way because we know that at these higher levels, right, that is usually where the effects are stronger, the psychedelic experiences come in, and like I said early on in this presentation, those psychedelic effects tend to correlate with higher healing power and with bigger antidepressant effects. So that is how we usually work, also when we work in groups or in retreats. So we try to have high enough dosages so that people have these psychedelic-like experiences. Another approach that you most likely have heard about are ketamine infusions, or also ketamine injections, intramuscular injections, like in most ketamine clinics. So in ketamine clinics, ketamine is taken as a medication for mental or physical health, and that usually happens without counseling or therapy involvement or the encouragement of therapy or counseling. So it's usually considered a pharmaceutical intervention, another medication to take. And I have, and Camila as well, like we have people who come to us for integration or therapy who do treatments in ketamine clinics. So we do know that when people come to us, they oftentimes we have to almost start from scratch and teach them about preparation and how to work with a medicine, because they just talk to a doctor and they come in for a session and they get the effects, but don't really understand any of what I just shared with you. So they may have still these misconceptions, right? Or just really no idea of how to work with the experience that they were given. And then there's also at-home usage, which are these delivery services, like, for example, MindBloom, that are emerging, where ketamine is taken, again, as a medication for mental or physical health at home without any professional supervision and with either very little or no counseling or therapy involvement. So there are certainly companies that do offer online the opportunity for these people who are choosing to do it at home by themselves, to do preparation sessions or to check in with a therapist. But it's usually not a strong planned process that they enter. So the packages or the pricing that people see, right, that oftentimes seems like, oh, right, that's more affordable. Let me do it by myself at home, right? Like usually I would say people do it because of the lower price point, right? And cutting out therapy. And again, going back to the misconceptions, are hoping that by receiving the ketamine in the mail at home and doing it by themselves will give them relief, right? At a lower price point. But again, oftentimes people then call because they say, yeah, I've done 6 sessions, but I'm not really sure what to do with it. We can't stress enough like how important preparation and the work with a therapist is, because it really allows people to understand what they're doing and to drop into the experience and to work with it. It really, really, really is key. And it is also key because we all know as therapists how frightening it is to let go of our usual modes of being and knowing. We all know about defenses. We all know, right, how hard it is for our clients to open up to pain, to what is sitting underneath their suffering and their symptoms, right? And so also doing these treatments in either clinics or at home is something I would not advise to anyone because material might come up, and it really takes knowing how to journey with psychedelics, to not be afraid, and to have that supportive hand by your side to get through whatever is frightening people, to really have this effect of coming out of it and saying like, oh, that was actually beneficial going through this. So therapy is a key component to success in psychedelic-assisted therapy, not just for ketamine, for any psychedelics that are making their way into our field. So ketamine as a psychedelic-like substance does loosen defenses. It allows for this previously unconscious material to emerge into awareness, and this can be beneficial. This is our catalyst for therapeutic work or for psychological growth and healing. But it can also bring on grief, frustration, and a host of other emotions as clients are becoming aware of their inner world and the change, the transformative change, because sometimes it's very quick change. So people don't have, right, that almost like that warning, right, or that slow progress where we can kind of feel our way into change, right? Sometimes you kind of get thrown into like the state of peace and people don't even recognize it, right? Because they haven't had these years or months of time of getting used to it and noticing the change as they're moving along this path of healing. So it can be disorienting sometimes to all of a sudden feel at peace or feel joyful, right? Is that what is this what joy feels like, right? So in integration, which is a psychedelic therapy term for the therapy that psychedelic therapists like Camila and I do shortly after a psychedelic experience, where we focus on helping a client understand their experience, as well as the psychedelic unfolding process. And by unfolding, we mean the process that clients undergo, not just during the dosing session, but also the inside unfolding process that happens in the days and weeks after a psychedelic experience. So the way the process works is clients usually have preparation sessions where they learn about journeying, where they learn about ketamine before they enter a dosing session. A dosing session takes anywhere from like, say, like 2 to 3 hours, more likely like 3 hours in the beginning. In that dosing session, people will talk about their intentions. There's usually some calming, right? So that they can drop out of their head and more into their body and feel more calm. They're reminded of the tools that they have available, like their breath, to guide them through the experience. They swish the ketamine for 20 minutes or 15 minutes. They slowly enter the psychedelic experience that lasts about 45 to 60 minutes. And then there's another hour where people slowly come back to the ordinary state of consciousness, right? Again, that takes about an hour where they still very inward, very open, right? But slowly come back, are able to move their legs, their fingers. And then about after 3 hours, they're usually good to go. They're oriented back to themselves, to time and day, and they're able to leave our offices. That openness, that state of openness that gets created with psychedelics does not end when people are leaving our offices. The process is actually only starting. So the day, ideally the day after or within 3 days of a psychedelic session, we usually get together for a talk therapy session with our clients. That is the time where we talk about the experience, because oftentimes as people are coming out of the session, they don't really feel like talking. They're still in the dreamlike state, right? They're still kind of under, right? And so that is not really the time for us to do talk therapy and to really go through it. So we just gently encourage people, if they want to share, we listen. We may ask some gentle questions, right? But we may also redirect them to just being with themselves and to enjoy and to listen into what comes up, right? And then sometimes like people have more insights, more experiences, like we just encourage them to experience, to continue experiencing. Or we encourage them to journal, to have this continued exchange with their unconscious, see what comes up. Or we encourage them to draw or to paint, right? To encourage this process of seeing what comes up. Oftentimes things are also what we call ineffable. They're very hard to describe with words. And so art or writing is sometimes very helpful for people to make sense or to just, bring images to life, right? Or to be able to express their experiences in different ways. It could also be movement if you're an art therapist, right? It could be through different ways. But we really encourage this exchange with their experiences in many different ways. So that is what we do in integration. And that is also a time for us where we work with people and helping them understand if they're frustrated, right, or don't understand the experience, to check into their body, to help them understand if you're frustrated, this was meant for you. What does frustration mean? What else do you notice? Check into your body. What are you sensing? Oh, I'm sensing a sense of calm. Oh, where do you feel that? Oh, I'm feeling that. Oh my gosh, I've actually never felt calm. How could I miss that? I thought I was supposed to have like some logical insight, right? Some message from the beyond, right? So people often don't understand how to work with it. And that is what integration therapists do, right? Like we understand how to work with it. So we help people recognize the change that has happened to them. So that work is really crucial. And the ongoing therapeutic work supports clients through this deeper inner work that has opened, usually with increased calm and motivation to establish or follow through with goals, or with a deepened connection to themselves, with an increased capacity for self-compassion and tolerance for their feeling world. So that is what is also so magical about it, right? That whatever these psychedelics do to us, that it makes the work in therapy, it transforms it, it makes it easier. It makes it easier. It deepens it. So I already mentioned the unfolding and self-reflection process. With therapy, as we all know, comes opening. With psychedelics come opening. And with psychedelics, we introduce movement. An ongoing back and forth between what they learned, what it means in daily life, what happened there in their experience, what is happening here now, how it changed their current life, right? Like this going back and forth, like this really understanding, oh, okay, I sense that. Well, what does that mean, right? How do I translate that into everyday life? And also it helps them to just put into action how they want to influence, how they want to change in the future. Like I said, psychedelics are not just active throughout the length of the journey. They keep working within us. They bring an unfolding of insights, the ability for ongoing movement and noticing of change and meaning. So part of the therapeutic work that is needed involves helping clients with this ongoing movement, with maintaining curiosity, with maintaining the openness that they experience so that they can have a continued discovery of feelings, of truth, noticing bits of impact that make a difference in their lives. So it truly is a process. And if you are introducing ketamine into your work, it is a recognition that it is a process. After ecstasy comes the laundry. We love this term. We did not come up with it. It's the title of a book by Jack Kornfield, which we can highly recommend if you have not read it. It does not talk about psychedelic experiences. It talks about the process in meditation of enlightenment. But again, these states of enlightenment, right, or meditation takes people to very similar places or the same place as psychedelics do. So it's a similar process. So once people have these ecstatic enlightening moments, right, with psychedelics or in meditation, there is this recognition, right, that you have to come back and do the laundry. You cannot always stay in the state of enlightenment. This mystical, amazing feeling, right? And again, that is what we mean by process. It is work. Ketamine or any psychedelic for that matter is miraculous, but it is not a miracle pill. It simply helps guide us to new patterns of thinking. It enables us to engage in behaviors that promote well-being, but we still need to pay attention to the effects and we need to act on them to keep growing those new pathways, right? That is what we mean by the changes that happen, right, in our brain and neuroplasticity. We cannot forget that when we hear that a drug causes neuroplasticity, it means that it creates the probability that those neural circuits will be engaged by certain activities, but one still has to engage in those activities. And some people get hung up on the actual experience and focus on disappointment of what they got or didn't get, as opposed to focusing again on this process, taking in the signals of change that are there, that are created with these medicines, whether it's new sensations, new thoughts that weren't there before. And that is where the work with psychedelics really is, and where ongoing therapy helps to make a difference. The reason why we have so much faith in the process is that, we observe and see a lot in the work that we do with clients. We don't necessarily, at least not yet, right? Like with the work that we do, try to come out and postulate new theories about the self or claim that we know, right? Like now what the ego is and throw psychoanalytic theories overboard, right? That is not what we do or what we aim to do. We simply listen to our clients' experiences and their understanding of whatever it is that they're experiencing and the language that they have. And we may bring our orientations, right, or our training to it. So whether it's clients meeting aspects of themselves, right, like IFS, like meeting parts, whether they feel like Michael Pollan was saying, right, like a freeing from the ego, whatever that means in their experience to them, whether it's a feeling of I or their authentic selves, connecting to inner wholeness, forms of consciousness, religious feelings, past lives, re-experiencing birth, moving from the inner and outer, getting in touch with their bodies, right? Like we listen, we hear all of these different terms, words, experiences. And so we just have this attitude of faith. We witness meeting clients, right? Like we wouldn't call like the worst, right? But what they would say, right? Like they're feared or believe like the worst parts in them, right? And we watch them survive them. We watch them move through these experiences and come out in different ways. We see them making room for themselves. And we support them through the impact of their truth, right? Which without psychedelics, with everyday consciousness, many people are ill-equipped to take, right? So psychedelics help, and we see it work. We are helping clients achieve more openness to experiencing, both during and after the psychedelic experiences with ketamine or other psychedelics. And we tend to witness this growing ability to process and to experience self, other, and the world, right? And whether Beyond said it a long time ago and we see it in our everyday work, we know that this openness to this unknowable ultimate reality is somehow linked with growth processes. This meeting of the self, the going beyond the defenses, right? To really going deep within ourselves, growth happens. And we see that. We see it every time working with clients. And again, as Beyond says, truth is necessary for psychic growth as food is for the body. And I would say that that is what we're seeing in our work. What we also love so much is how deeply relational ketamine is. So it provides this feeling of deep knowledge, this deep understanding of oneself and others. It helps increase connection to oneself and others and the world. It has this experience for many people of being seen and accepted by their community or therapist, oftentimes for the first time. Many people in the States say, oh, for the first time, I'm feeling fully seen and heard. They're experiencing a feeling of calm, sometimes for the first time in years, or a sense of joy or peace or whatever it is. And they often manifest a feeling of empathy that they've never experienced before. And all of that carries forward. It carries forward in therapy, which is why I'm saying it's such a wonderful agent in our work and for you as well in your work. Yeah, so I'm gonna skip this. Okay. So we know that these experiences of mysticism, right, of meeting our inner healers is very powerful. Having these ego dissolutions, these states, psychedelic states, is a contributor to growth, to healing, right? And that is like what helps us have faith in the process because we see it work. And the other piece that gives us always a sense of, faith in the process is the neuroplastic changes. And these neuroplastic changes occur over days and weeks following a ketamine experience, right? A client's process is only starting with taking a psychedelic. They're, like I said, entering the special open space in the body and in the brain. And if this time is spent with being curious, the client will notice little changes that will give rise to bigger changes. And the way that the ketamine specifically does it is one, it acts as a growth factor in the brain, allowing specific neural circuits that control things like mood, outlook on the future, self-reflection, etc., to change in ways that provide significant relief and opportunities for life changes. We also know that it works on the disappointment circuits in our brain. So the reward pathways are more available. So we see that people tend to engage in pro-healthy behaviors more, like seeking out work that is stimulating. They feel more motivated to seek out social engagements, to take better care of their bodies, their mental health. They just feel more motivated because those circuits are activated. And ketamine also bolsters connections with the frontal cortex. So we oftentimes see this, like this capacity for strategic thinking all of a sudden is there. They're able to strategize better how to get what they need. So oftentimes, like we also call it like this sense of like just being like more connected and feeling very authentic. Like they start asking questions like, does this serve me? Am I getting the results that I want from what I'm doing? What can I do differently? Or what do I actually need?